I'm Dr. Rozman Mohamed Idrus. I'm from KPJ Damansara, a private hospital in Malaysia. I'm the medical director of the hospital, and my duty is to bring in the culture of patient-centered care to the hospital rather than the traditional me doctor, you patient concept of patient care, which has been going on all this while. We need to see our care more in patient's perspective. What they expect, what do they want, rather than this is what I'm offering you. I am the doctor, I know best, you are the patient, you accept. We'd like them to tell us what they want, what they would like, or in other words, change positions. If I was the patient, what would I like? And if the patient is the doctor, you want them to understand why you're doing what you're doing instead of just you telling them what you're doing is right, except the patient does not understand why you're doing unless you get them involved in the discussion of what are the treatment options that's available. So we'll go saying there's more than one way to skin a cat. So sometimes you have to give the patients the options of treatment and get them involved into the decision making of what is best for them. You may think what you're doing is best, they may not like what you're doing just because they want the other option. So in patient-centered care, it's more like offering the patients, these are the options, and getting them involved in the care. So that's the difference from the traditional patient care before this. See, I would like the caregiver to see more in the perspective of the patient itself, rather than caregivers saying this is what I am giving you. So like we involve the family in the care, we involve in the, say if a patient ends in emergency, usually the patients will off, the doctors will be looking after the families outside. What I'd like to see is more involvement of the doctors consulting the family, say this is the situation, this is what we have, okay, let's discuss whether this is the best option or what you all would like rather than what is available, and take it. That is what I like. I like the more involvement of the patient and the family in the care so that we get the best of both situations. What I would like is actually medical schools in the teaching involves the patient's perspective of being a patient from the beginning. We were taught empathy, we were taught sympathy, we were taught how to talk to patients, but we have never involved the patients from the beginning in the patient's experience. If they come to the hospital, what they expect from the medical student, what they expect from the doctor, how would they like the doctor to speak to them, how they would like the doctor to explain to them. That is what I'd like to see in the future, where there's more involvement of experience of somebody who's been a patient to tell the doctors this is what it should be, or this is the way it should be, so that the doctor feels for the patient from the beginning rather than being a doctor and telling the patients this is the way it's going on, you accept what I'm giving you. That would be my so-called expectation in the future. Well, I was sick when I was very small, and there was a doctor who cared for me. That was when I actually got into medicine. It's a novelty profession. You help people out. That's when I got started with that. So then I went one step further into not just helping people, but getting people who I'm going to help come forward and tell me how they want to be helped. That's why I'm here. I flew 22 hours from home to get here, from Malaysia. So, but it's been worthwhile. It's been worthwhile to see the other side of the story, if you call it. So that's what my condition at the moment.